Hola chicos, queridos SCOPEnguins. En esta oportunidad, el comité SCOPE-USMP, como parte del proyecto Cultural Exchange All About Global Health, les trae una charla dirigida a todos los estudiantes de medicina sobre el sistema de salud en Brasil, así como el sistema de educación en la carrera y las medidas tomadas por el gobierno brasileño sobre la pandemia actual. Esta ponencia está dirigida por Bruno Reís de Moura, estudiante de medicina de quinto ciclo de la Universidad Federal de Pernambuco, y actualmente él es integrante de la Liga de Urgencias y Emergencias de Grecia y es presidente del directorio académico de su universidad.
Hello, good night everyone. My name is Bruno Reís de Moura, and I'm very happy with the invitation to make this presentation for you. This presentation is an overview of three very complex themes, but which I hope to clarify today. I'm still developing my English, and so if something goes wrong, I can try to explain it in Spanish, okay? So, about the SUS. SUS is the name of the Brazilian public health system, and the means is Sistema Único de Saúde in Portuguese. And this is your brand logo. It is one of the largest and most complex health systems in the world because it covers the entire population of Brazil and the entire territory. So the population of Brazil is around 210 million. So it's a big system. You know? The SUS is based in some principles, and these principles are universality, which means that everyone can access it, equity, as people have different conditions and needs. This principle aims to reduce inequalities, and completeness. This principle considers the person as a whole, and therefore health must be articulated with other public policies like economic policies and worker policies. The organizational principles of the SUS are decentralization with a single command. The responsibility for decide the policies of the SUS is the main command is the Ministry of Health, but the states and the cities have your responsibility too. Regionalization and hierarchy. So services must be organized and increasing levels of complexity. Regionalization is a process of articulation between the services that already exist, aiming at the unified command. The unified command is the responsibility of Ministry of Health. Popular participation. The people must be participating in the system through the creation of councils, popular councils, and the private complementarity. SUS can negotiate partnerships with the private health systems in those areas where it has a disability. So there are many private hospitals that give services to SUS. The SUS managed structure. In this picture, we can see the map of Brazil, and we can see all of the states that the Brazil has. So We have 26 states and 1 federal district. The federal district is here, is the capital, Brasilia. And my state, it's important to see the regions of Brazil. The North region, the Northeast, the Middle West, the Southeast, and the South. These ones, the North region and the Northeast, are the most poor regions, especially the North one. So the structure of the Minister of Health, the state health secretaries in each state and municipal health secretaries. In Brazil, we have more than 5,000 of cities, and each city has a secretary of health, like the states, like the 26 states and the federal district. Each one has a secretary of health, and then have to help the Minister of Health with data and to develop health policies. The functions. So the Minister of Health he is the SUS. It is the SUS manager. Is the main financing, and the Minister of Health formulates, regulates, inspects, and monitors and evaluates policies and actions. The state's health secretariats financing, implementation of national health policies, create your own health policies, and they organize of healthcare in the territory in each state. The cities. The cities are responsible for financing, implementation of national and state health policies, create your own health policies, and execution of action and services. So the care network, SUS, is based in a care network, the execution of SUS. In this, we can see in this picture, the central point and on one of the main doors of entry of SUS are the family health units, right here. The family health units are present in the neighborhoods of each city. From this point in the network, the patient can be referred to another more specialized point, such as regional or reference hospitals, and withdraw medication for basic or right cost pharmacies. Here, high cost pharmacies, basic pharmacies, and references hospital. All these points in the network communicate and feed an information system. It's an important point of the care network, the information system, because it can direct the patients for each point of the network. In this image, we can see the main components of SUS, which should work in harmony as points in an interconnected network. Here on right is the basic health unit, the family health, which should be the main gateway of SUS users. It will carry out complexity procedures, first check census, and follow-up from the community in which it operates. Here we have health units with stabilization rooms, and here we have the 20 hours emergency care units, which are responsible for handling acute and emergency cases of low and medium complexity. Here we have the SAMU, SAMU, the SAMU Regulation Center, which is a mobile emergency care service with many ambulances and teams, and which performs the first care and transportations to emergency care units and hospitals. Finally, right here, this announcement, if you don't drink, don't drive, which represents prevention and health promotion action, which is also done by SUS. So the numbers of the health system, the Brazilian health system, the SUS. About the Brazilian Brazil's investments in SUS is equivalent to approximately 3.8% of the country gross domestic product. So in the last 4 years, they have been over 10 billion of reais, which is equivalent to 60 billions of Peruvian soles. It's a large investment. The demographic indicators of the Brazil. About the Brazilian population, like I said, we have 210 millions. Other the relevant data, 25.3% of the population below the poverty line, 9.7% without garbage collection, 15.1% have no water supply, 35.7% do not have access to sewage network, and the life expectancy for men is 73 years old, and for women 80 years old. In this graph, we can see the Brazilian currently has the majority of its population at an economically active age, which is important information when we think about COVID, which is a more dangerous disease for the elderly. The share of the elderly people in our population is relatively smaller than of the several European countries. For example, in these countries, there are a lot of elderly people. So about the Brazilian medical education. In Brazil, there are 341 medical schools and 133 public and 208 private. The total vacancies per year is 35,000. So when we calculate the proportion of the population by medical school, we can see that Brazil has a very large number of medical schools for the size of its population. This is because in the 10 to 15 years, there has been a large opening of new public and mainly private medical schools. But there was no planning. The consequence of this is with each passing year, the medical profession is more devalued, and with the reduction of the jobs vacancies and loss of salary. I did a search in Peru. You have 1 million inhabitants for one school, for one medical school. It's close to USA and UK, but in Brazil we have 6,000 people for each school. So according to my search, the Brazil is in third place. The first is Bolivia, and second, Cuba. Or Cuba is the first, like some of this. Teaching methodologies of the medical schools. The medical teaching methodology used in Brazil are two, are traditional and problem-based learning, PBL. Approximately half of the schools use one and half use the other. But in the coming years, all should start using the PBL. My course, for example, already uses the PBL methodologies. General about the course. In Brazil, as in many places, the course consists in 6 years, 4 years of the theoretical and practical teaching, and 2 years of practical internship. I believe in Peru is like that. I don't know, but I believe. The medical residence program is managed by the Ministry of Education, and we have more than 55,000 vacations per year. All residents receive a scholarship, with this amount to help them with their expenses, and this scholarship is like 3,000 reais. On the map below, the states with the darkest color are the ones with the most occupied medical residence. So we can observe that the states of the south and southeast region concentrate the greatest number of vacations, and that is in the northeast region, Bahia and Pernambuco are those that have more vacancies, as they are important Brazilian medical centers, despite being a poor region of the country. About the requirements for the foreign physician a foreign doctor to residency in Brazil. The requirements after graduation, some of you may wish to do medical residency in Brazil, and here I have separated the basic requirement required of foreign doctors who have this desire. Graduation diploma in medicine, the first graduation diploma in medicine revalidated in Brazil. Some Brazilian universities perform revalidation of evidence of foreign diplomas. it's necessary to be a member of the State Regional Council of Medicine. Each state of the federation has a regional council of medicine. It's necessary a Portuguese language proficiency certificate and a stay visa in Brazil, like a student visa. So let's talk about the COVID-19 in Brazil. Here we have a timeline of the pandemic in its first 2 months. The first case in São Paulo on February 26. The first case of community transmission on March 5. The first confirmed death on March 17. The first city to start the quarantine was Salvador in Bahia, in Northeast. Sorry, 1 month after this first case in São Paulo, 1 month after, we already had 77 deaths and almost 3,000 cases. And 2 months after the first case, the number of deaths was already 4,206 deaths and more than 60,000 cases. Here the daily evolution. Regarding the evolution of new daily cases, we can see that Brazil has the highest number of daily cases since the beginning of the pandemic. There are about 20,000 new confirmed cases per day. On 20 May, there was downward trend, but today, in the last 30 minutes, the government published the new data, and the cases go up again. The evolution of total deaths. In this graph, we can see the evolution of total number of deaths, which has already exceeded 20,000 people. In May, there was a big increase. And he knows we have is that in some cities like mine, Recife, there was very few beds with respirators available. The geographical distribution of that. In this image, we can see which states had most deaths. The states with highest number of deaths are São Paulo and Rio de Janeiro. Ceará, Pernambuco, my state, and Amazonas, and Pará. The northern region of Brazil is poor and has a worse health structure compared to other regions, especially the north one. About the mortality for our 100,000 people. The darkest states on the map are the ones with the most deadly pandemic. And as we can see, the states in the north and northeast regions lead these statistics. The poverty and the majority of the population are the majority of population and the poorly structured health system are the reasons. So these states, more people die per 100,000 people than the southeast and the south. Even with more cases, São Paulo and Rio de Janeiro have fewer deaths proportional to the population. For all those who want to follow the Brazilian information, we have more. I recommend this Brazilian government website, which is updated every day. I will show you. In this website, we have a lot of data, and this website is updated. Is the last one is today 7 p.m. So we arrive on 21 and 48 deaths today, and 330,000 of cases, of confirmed cases. Here we have other data by region and by each state. In Northeast, my state is it's Pernambuco, and the deaths in Pernambuco is 2,057. And there are many other graphics. This one is that graphic, but this is not today. So if you want to know and to see the information of the COVID in Brazil, you can to access this website. About the social isolation measures, on the social isolation measures, emphasize that each state defines its rules, and most common rules it's only essential services can open. People can only go out in case of need, like buy food, medicine, and medical appointments. The use of masks on the streets is mandatory, and the cars too. And there is no deadline for the end of the measures. A lot of governors in states didn't define the deadline. The population don't know when the quarantine is over. About the medical student, our medical students classes are our medical classes are interrupted. Was interrupted. Like all other students, the Ministry of Education allowed universities to do distance learning, but many they're not doing it because part of the students don't have good access to the internet, or they don't have a computer at home. All medical students were able to register for the program Brasil Counts of Me. Brasil conta comigo, em português. Which is a register to help with the pandemic if the government requests. In my college, few students have been called so far. The Ministry of Education has allowed universities to anticipate the graduation of students who have already completed at least 75% of the 2 years of education practical. The university has the power to decide whether to anticipate or not, and some, like mine, decided not to anticipate. The Brazilian difficulties. It is a complex thing. The first of all, we have an intense political crisis. Since the former president's impeachment, Pierre Dilma Rousseff, amid intense corruption scandals, politics and Brazilian society were extremely polarized. One of the hand, the current president Jair Bolsonaro and his liberal allies, and on the other, the socialist, labor, and political parties that ruled the country for 13 years. Major newspapers and television channels have also been strongly opposed to the current government from the beginning. With the arrival of the COVID-19 pandemic, the two sides started a great political battle in which the Brazilian population is being severely affected. We were in the middle of the pandemic, the resignation of two ministers of health and the resignation of the Ministry of the Justice, who is a former judge recognized by the Brazilian people like a combat to the corruption symbol. We have this problem too, the corruption. As I said before, many politicians are taking advantages, lower bureaucracy for public purchase, and are diverting resources destined to for the pandemic. In the past few days, many corruption scandals have been reported, such as equipment purchased at twice the price, unexplained expenses, and others. This one is other Brazilian problem in the pandemic. The Brazilian Supreme Court decided that states and cities can decide their own policies to combat the pandemic, independent of the decision of the federal government. So it's a big problem because each state has your own your own measures. Political debate on drugs. So President Bolsonaro elected this drug, hydroxychloroquine, like important, as important in combating the pandemic, even without scientific evidence. On the other hand, his opponents strongly criticized the use of this drug. And the Brazilian population was lost in this debate, which should be debated only among health professionals, not for politicians. Lack of beds. Some cities are suffering from few beds and respirators, and there is a rush to buy these devices and open field hospitals. I think, I believe in all of the world, the governments are searching for respirators. Lack of personal protective equipment. There are many health professionals reports about the lack of equipment, such as masks and shield faces, and alcohol, and disregard for isolation rules. It's a big problem too. Despite the isolation measures, there are cities that reported that more than half of the population was not respecting. One reason is the difficult economic situation of many families who depends on informal jobs and who work during the day to be able to eat at night. So these people can be at home. For these workers, the government is paying a salary of 600 per month as an emergency aid. More than 30 million people are receiving it. To know a little more about our university and our academic directory, you can follow these Instagrams. This is mine, and this is of our academic directory. And thank you, and I hope to visit Peru in the future. And I want to see you here in Brazil in medical residence.